children are being affected. The reasons being, there is definitely a disruption in their routine school activities, and there is also a disruption or irregularity in their meeting with friends, and there has been a constant pressure on them because the parents have been at home for longer hours under supervision. So which brings about a lot of emotional disturbances, behavioral disturbances, cognitive disturbances among these children. There have been a less interaction with the playgroups, which builds their personality or a character among children, especially adolescents. This is a time where they tend to become more irritable, more aggressive towards parents, more tantrums and oppositional behavior, demanding, more addictive behaviors, which we tend to come across in our daily routine practice. Many children of late have been brought to our clinical setting where there have been significant disruption in their daily routine in terms of their eating behaviors, in terms of their sleep, in terms of interaction with the parents. To provide a good environment, listen to them carefully. You are the one who can understand your child much better than anybody else. So this given opportunity should help the parents to listen to the child carefully. Otherwise, many children we tend to see they manifest in different ways. Clinging to their parents, feeling more anxious, more agitated, having nightmares, bedwetting, getting isolated, sitting in one place, not being interacting with anybody else, being sober. So unless you provide an opportunity for a kid to express their feelings and provide a necessary information for the kids in their understandable way, not to panic, and the limited information about the COVID pandemic will also suffice and important at this point in time, rather than spreading rumors and having speculations, which becomes more panicking for a kid who is able to understand only in a limited way. Of late, the children are being brought to us with the complaints of headache. So what is the reason? Here we see many children are spending excess amount of time on screens like gadgets for their academic purpose and for the extracurricular activities. And also there have been reports from the parents saying the child goes to bed only at 1 or 2 o'clock. Till then the child will be playing. So this disturbs the normal regular sleep cycle among children. So which could also influence the somatic complaints. We call it as headache in our routine practice. So what we need to do, the child should have a daily routine practice of using a limited screen time or gadgets for a particular activity, for a particular duration. Kindly restrict them from using by encouraging other creative activities and other activities which they feel more interested, rather than imposing things, do that, do this, which should not be done. As you all know, we have been working from home for quite a long time. So there may be issues within the home which can have an impact on the kid with respect to the growth and development, interpersonal relationship at home, financial burden, work-related stress. So these can have a bad impact on kids. So try to minimize the effect of these things on your kids. Be cautious and conscious as well. Of late, we tend to see many kids have been brought with two major complaints. One is tantrums or oppositional behaviors. The second one would be using gadgets or mobile for longer hours of time. So two things of very important concern for a parent, because the parents are also being at home, almost supervising each and every activities of the kid. So schedule a time where the child will have enough time to play or use a gadget for a particular period of time, which will reduce the burden. If you tend to say that you should not use the mobile, which is not possible at this point in time, but however you can minimize or restrict the screen time. In terms of oppositional behavior or irritability or anger outburst, give the space for them. You take deep breaths, 5 deep breaths, so that you tend to become more relaxed and try to address their concern as and when necessary. It will reduce the burden on parents, and also child gets a way to express their feelings. So a child and a parent better interaction will give a better coping for both of them rather than fighting and getting into trouble often. Don't show your frustration on children, which could have a significant impact. This is a growing age. They need more support, moral support, rather than a punishment, which can bring about a drastic change in their behaviors in terms of negative ways.